TMJ Guide for Women. A beginner's quick start guide to managing temporomandibular joint disorders through diet and other lifestyle remedies. Introduction. Temporomandibular disorders, also known as TMJ, are a group of conditions that affect the temporomandibular joint, which is the hinge that connects the lower jaw, mandible, to the skull. The temporomandibular joint is responsible for movements such as opening and closing the mouth, chewing and speaking. TMJ disorders can cause pain in the jaw joint and muscles, clicking or popping noises when opening the mouth, and problems with biting or chewing. The most common type of TMJ disorder is temporomandibular joint disorder, TMD, which is a catch-all term used to describe any condition that affects the temporomandibular joint. TMD can be caused by several factors, including tooth grinding, bruxism, trauma to the jaw joint, arthritis, and dislocation of the jaw. Other less common TMJ disorders include myofascial pain syndrome, which is a pain in the muscles surrounding the temporomandibular joint, and craniomandibular disorders, CMD, which are disorders that affect both the jaw joint and muscles. If you are experiencing pain or other symptoms in your jaw joint, it is important to see a doctor for diagnosis and treatment. Treatment for TMJ disorders may include medications such as painkillers or anti-inflammatory drugs, physical therapy, braces or splints to keep the teeth in alignment, and surgery. With proper diagnosis and treatment, most people with TMJ disorders can find relief from their symptoms and resume normal activities. The following are some of the subtopics that will be discussed in further depth throughout this guide. What is the temporomandibular joint, TMJ? What causes TMJ disorders? What are the symptoms of TMJ disorders? Who is at risk of TMJ disorders? What women should know about TMJ disorders? How are TMJ disorders diagnosed? What are the treatments for TMJ disorders? Managing TMJ disorders symptoms through natural remedies. Managing TMJ disorders symptoms through diet. Read on if you want to learn more about TMJ disorders, their causes, symptoms, and treatment options. What is the temporomandibular joint? The temporomandibular joint, TMJ, is the hinge joint that connects the lower jaw, mandible, to the skull. The TMJ is responsible for several movements of the mouth, including opening and closing, chewing, and speaking. The TMJ is a complex joint with many different muscles, ligaments, and bones all working together. The TMJ is
Sample complete. Ready to continue?